So you want to be an occupational therapist. Well, my name is John Luna, and I am an occupational therapist. And in the next 10 minutes, I'd like to take some time to tell you a little bit about my profession and how you can become one. So let's jump right in. So, one of the first questions you have to be asking yourself is, what is occupational therapy? So, to answer that question, let's break apart that word into occupational and therapy. So, the first one, occupational. No, we don't help people find jobs, but the best way to explain occupations is if you do a little exercise with me. So I want you to close your eyes and I want you to think of everything that you have done since you woke up this morning and everything that you will do until you go to bed this evening. All right. Now, all these tasks, everything from waking up to brushing your teeth to eating to showering to getting dressed to driving to socializing to walking the dog, these tasks and activities are all occupations. They're the valued things that make our roles, routines, and habits and really make us complete. They give us a sense of accomplishment and they allow us to pretty much function in a number of settings on a day to day basis. So when we look at that, that's what an occupational therapist does. An occupational therapist helps people across a lifespan from 0 to 99 participate in the things that they want, like getting dressed in the morning, eating, and the things that they need to do through the therapeutic use of everyday activities or occupations. So because there's so many of these little occupations that are important to so many different people, what can an occupational therapist do? So there's a lot of different areas that you can specialize or that you can kind of become trained in, if you will. Everything from assistive technology, seating and mobility, aging in place, working with children with ASD, brain injury, hand therapy, lymphedema, driver rehabilitation, stroke rehabilitation, low vision therapy, hippotherapy, which is one of several types of animal assisted therapies that occupational therapists participate in, sensory integration, among many, many other specialties. Now, because we have so many areas that we can work in and specialize in, that means that there's a lot of job opportunities and many different settings that you're going to find an occupational therapist or an OT in. Let's take a look at some of those real quick. So what can an OT do? So an OT could work in some settings that you might expect, like a hospital or a school. You might have seen him in an elementary school, in a high school, or in a university, like me. Outpatient rehab facility, that's where the patients come and visit and go home. Inpatient facility, that's where the patients might live there for a short duration of time. Early intervention, that's working with children 0 to 3. Home therapy for pediatrics and adults, that's where we go to the home to do the therapy. Skilled nursing facilities, residential care for clients that might have some pre-existing medical conditions. Mental health, and I have to take a quick moment about mental health because there's a lot of people that love psychology, and did you know occupational therapists can work with mental health clients and helping individuals with mental health diagnosis and disorders, again, return to the activities that they enjoy doing. NICU, that's the Neonatal Intensive Care Unit, working with preterm infants. Veterans Hospital or any one of the Veterans Administration System type caregiving settings, aquatic therapy centers, hippotherapy, community health, as well as participating in research. So one of the best persons, or one of the biggest questions that I get is, what is the best part of the job? So again, the best part of the job pretty much is our client success. It is so rewarding to see our clients succeed on a day-to-day basis. I really can't express to you how rewarding and what a big part of that job it is. In addition to, again, seeing the success of our clients, occupational therapy is a very financially rewarding job. And again, there's a good opportunity for you to, again, make a pretty comfortable living at it. So overall, according to the Bureau of Labor Statistics, the average salary in 2018 was $84,000 for an OTR. Now, there are assistants, that's a different type of OT, different level of education, that can come in around $56,000. But we're going to talk more about how you can become an occupational therapist, right? So let's jump into that in terms of how you become an OT. So there's 2 points of entry into our profession. One is the entry-level doctorate, which we are transitioning to. Hopefully in the near future, we might have that program here for you, as well as an entry-level master's, which is what we have here. Now, most of the master's degrees are anywhere between 24 to 36 months. They might be in person or online. And once you complete that particular program, you're eligible to sit for your national certification exam by NBCOT. Once you pass the NBCOT, you're eligible to apply for a license in any state that you desire to work. Now, where, you might ask, is the nearest occupational therapy program? Well, wouldn't you know it, we have an occupational therapy program here at the University of Texas, Rio Grande Valley. Now, a little bit about our program. Right now, our program is a master's program. We hope that one day it will become a doctorate program, and we're in the process of transitioning. But right now, we're going to talk about our current program. It is 8 semesters long, or about 2.5 years, give or take, and you go through 71 credit hours. Now, during your 71 credit hours, you do some classroom work, which is where you sit in classrooms, you do lab instructions, things like that. And that goes for pretty much about 2 years, give or take. And again, it's pretty fun, very exciting, and a little bit intense at times, but again, you learn a lot. Now, at the end of those 2 years, your kind of class experiences, you go out on field work and you do 24 weeks of field work rotations. Now, during that time, you're assigned to a clinical instructor in a specific setting. Typically, we might place you in a pediatric setting or an adult setting, because those are two big populations that we work with, because again, it's across a lifespan, so pediatrics to adults. And pretty much you'll spend time with a occupational therapist, pretty much learning on the job some of the on-site things that you do on a day-to-day basis. So that's really where you take what you've learned in the program and you start to apply it to everyday patients on a day-to-day basis for those 24 weeks. Now, again, for our program, once you finish the field work, you're eligible to graduate with a master's program from the University of Texas, Rio Grande Valley, and from our occupational therapy program. After that, what do you do next? That's right, you're eligible to sit for the NBCOT, and then you apply for a license in whatever state you choose to work in. So how do you get into the OT program? So lots of questions about that, but again, the process is pretty simple. So let's jump right into that. Now, I'm going to include helpful links so that you can see what these prerequisite courses are and things of that nature, but you want to make sure that you take prerequisites and graduate from an accredited university with a bachelor's degree. Now, here's the thing. When a lot of people ask, well, what degree do I need to get into OT? And we see a lot of people with degrees in social work and kinesiology or health and human performance. Speech, communications disorders. You name it, psychology. There's a number of different degrees that pretty much we accept. It's pretty much any bachelor's degree. So that's where the prerequisites become really important. Because we allow you to graduate or apply to the program with any bachelor's degree, we want to make sure that you have some basic prerequisite knowledge. So there are a few of them, things like anatomy and physiology, physics, biomechanics, technical writing. You're looking at anthropology or sociology, basic psychology courses, abnormal psych, things like that. That allows everybody to kind of come in with at least a basic level of knowledge and have the kind of that same, information coming into the program so they can hit the ground running. Additional things we're looking at is that you have to complete 20 hours of volunteer work. Now, OT is a profession of giving, and what we want to see is that, again, you're in that habit of giving back to your community, giving back to those around you. Now, the volunteer work can be in any particular setting, which means that you can even be working with different organizations. You can be working with a food bank. You might be even helping your next door neighbors, cousins, girlfriends, sisters, little kid and their t-ball working as a third base coach. And if that's your volunteer work, that's fantastic. We just need a basic documentation of those 20 hours in there. After that, you should complete a personal statement. And again, a strong application really looks at a well-developed personal statement. This is when we get a chance as the admission committee to know you as an applicant, telling us why you're going to be successful in the program and why you're going to become an occupational therapist and do lots of good for people one day. Finally, again, you're going to obtain 3 letters of recommendation. And again, these can be from anyone. Anyone that will say, once again, why you're a good candidate, why you're going to be successful in our program, and why you're going to be successful as a professional one day. Lastly, you're going to go ahead and you're going to submit your application to OTCAS, which is our Occupational Therapy Centralized Application System. There's a small fee for that, and then you'll also submit your application to the Graduate College here at UTRGV. So again, it's just that simple. Now, I'll include links along with this particular video to our website so you can see a little bit more of those breakdowns of some of the specifics that you might have, as well as some frequently asked questions. Now, the other question we have, because many of you guys are in high school, right? Or early in your college career. So another question you might have is, well, how early can I start preparing for the OT program? Well, again, the time is right now. There's a couple of things that you can do in order to prepare for a profession in occupational therapy. One of the things that I recommend is if you can start to shadow an OT. Now, that's not required for the OT program. However, it's not a bad idea because chances are in many of these settings that an OT works in, you might also get exposure to other allied health professionals like, physician's assistant, nurse practitioners, clinical laboratory science, speech pathologists, things like that. So you get a good feel for, again, OT, where we want to see you guys. But you also might get a good feel for some of the other allied health professions as well. The other thing I recommend is to volunteer at different settings. Remember, OT can work with so many populations and in so many different settings. You might volunteer or shadow an occupational therapist in a pediatric setting and think, this is totally not for me. Now, I'm biased. I loved pediatrics, and that was where I spent the majority of my time in the clinic. But if it's not for you, that's okay. I'd recommend then that you give it another shot and work maybe with a hand therapist and say, oh my goodness, you might find the spot where it's like, this is absolutely what I want to do for the rest of my life. Because OT has such a diverse areas that we can help out in, I definitely recommend that you give an opportunity to different settings so you can find that spot that's just right for you, because we need professionals just like you. The other thing that I would really recommend is to take advantage of some of those dual enrollment or dual credit enrollment opportunities, because what this does is this gives you time. When you graduate from high school, you'll graduate with some college credit. And if you don't, that's okay. You can still start. But if you can, that's fantastic, because this will give you a wonderful opportunity, again, for you to really plan out your prerequisite activities, as well as plan out when it is that you'll be graduating or applying to the program, so you don't waste any time. Because again, admission cycle for our program begins in July and it closes February 1st. So if you missed that window or you don't have all the prerequisites met by that point in time, you might not be eligible to apply. So that's why I say plan it out. You want to make sure you have all your prerequisites done before the application deadline of February 1st. So again, I hope I've given you at least some information or basic information about how to apply for the program. Again, I can't encourage you guys enough. Find out what an OT does. Explore some of those healthcare opportunities. I'd love to see you here in our program and would be both honored and privileged to take part in your education. Or I'd love to see you as a colleague in another allied health profession, either working with a degree in health and human performance, kinesiology, social work, nursing, physician's assistant, or any of the other wonderful degrees that you can get from our College of Health Professions or here at the University of Texas, Rio Grande Valley. Either way, I want to thank you so much for your interest in the occupational therapy program and your interest for helping other people. I hope to see you in one of my classes one day, and thank you again for your time. You have a fantastic day.